Good afternoon. I'm Metz, the chair of the Department of Psychiatry and Neurosciences here at UCSF. And I'm more than delighted to welcome you today to our brand new Nancy Frank Pritzker Psychiatry building into the Lisa Stone Pritzker Auditorium and Convening Center. It's wonderful to be able to see so many of you here in person, and we're also delighted to have about 150 people joining us via Zoom today. So thank you all for coming. This is a very important discussion and a timely one. Reimagining public safety, the role of trauma recovery centers. So today's panelists will address a critically important and, as I said, timely issue as communities around the country grapple with rising rates of gun violence, domestic violence, and hate crimes. And our conversation today will focus on the Trauma Recovery Center approach. This is a nationally disseminated model developed right here at UCSF, which includes assertive outreach, advocacy, evidence-based mental health services, and comprehensive and individualized case management. So I'm going to keep my comments brief today so we can hear from our wonderful panel. Today we're delighted to have Dr. Alicia Boccellari, the founder and creator of the TRC model, Dr. Sarah Metz, the director of UCSF TRC, both, I'm very proud to say, on our faculty here at UCSF Psychiatry and Behavioral Sciences. We also want to welcome Lenore Anderson, the president of the Alliance for Safety and Justice, and Tinisch Hollins, the executive director for Californians for Safety and Justice. And it is a special privilege and great honor to also be able to host today Ashley Biden, MSW, UCSF consultant to the National Alliance of Trauma Recovery Centers. So thank you all for participating in this important discussion. I also, before we start, want to express my gratitude to Adrian Ratna and the Michael Walker and our operations team in the Department of Psychiatry and Behavioral Sciences, the wonderful Chair's Office team, and Sarah Metz and everyone at the TRC and NATRC who helped make this event possible today. So I'm going to hand over the podium to Dr. Metz, who will further introduce our panel and will moderate our discussion today. Thank you all again for joining us.
Thank you so much, Dr. State, for opening us up and getting us started. And it's so wonderful to see humans in real life in a space together. So thank you all so much for taking time out of your busy days to be here with us today. And I'm so excited. What a badass panel. What an honor to be standing up here with each of them, moderating. I'm so excited. So without further ado, so excited to be up here with an amazing group of women talking about such an important topic. So thank you all so much for being here. So first, I want to welcome again Lenore Anderson. She is the founder and president of Alliance for Safety and Justice and founder and executive director of Californians for Safety and Justice. Lenore was the campaign chair and co-author of Proposition 47, a California ballot initiative passed by voters in November of 2014 to reduce incarceration and reallocate prison spending to mental health, drug treatment, K-12 programs, and victim services, and this funding helps to fund TRCs. Previously, Lenore served as Chief of Policy and Chief of the Alternative Programs Division at the San Francisco District Attorney's Office. She served as Director of Public Safety for the Oakland Mayor, overseeing the Mayor's violence reduction and police recruitment initiatives, and as Director of San Francisco Mayor's Office of Criminal Justice. She holds a JD from NYU School of Law and a BA from UC Berkeley, and she lives with her family in Oakland. Welcome. And Dr. Boccellari is Professor Emeritus of Clinical Psychology at the University of California, San Francisco, and Zuckerberg San Francisco General Hospital. She's also the Executive Director of the National Alliance of TRCs. She has spent her career creating, implementing, and overseeing new programs designed at removing barriers to care for underserved populations. She's one of the founders of the UCSF TRC model of care. She's been working with local and state governments across the US to transform victim services using the TRC model as a vehicle of change. Her primary clinical and research focus is designed at investigating innovative clinical interventions in public sector to see if these interventions can reduce barriers to care and improve clinical outcomes and quality of life for underserved communities. And through this, and dare I say she's been quite successful, she hopes to influence public policy and to improve healthcare services for underserved populations and those impacted by violence and systemic inequities. And next, welcoming Tinisch Hollins. She is a crime survivor and native of San Francisco. She is the Executive Director of Californians for Safety and Justice, the Alliance for Safety and Justice's flagship state-based program in California. She previously served for 2 years as CSJ's Associate Director, as well as the California State Director of Crime Survivors for Safety and Justice. Her leadership helped to pass historic, first-in-the-nation legislation that extended employment leave for all survivors of violence, as well as legislation permitting crime victims to terminate their leases if they no longer felt safe in their homes following the crime. She's been deeply engaged in the Bay Area social justice movement as the community organizer, policy advocate, and systems navigator for nearly 2 decades. She has worked passionately to bring the voices of survivors to the center of community engagement and public policy, and has advocated tirelessly for those voices to guide decisions, priorities, and resources. Thank you for being here. And Ashley might have the coolest middle name. Oh my goodness. Ashley Glazer Biden is a social worker, seasoned justice, reform advocate, and social entrepreneur. She is a consultant for the National Alliance of Trauma Recovery Centers and has also been a strategic consultant to other local and national organizations that work on mental health and trauma recovery. She sits on the board of the Pennsylvania Prison Society. Ashley served as the executive director of the Delaware Center for Justice, the leading nonprofit in Delaware, committed to transforming the quality of justice through advocacy, policy reform, and direct service programming for youth and adults impacted by the criminal justice system, including both perpetrators of crime and crime survivors. Ashley spent 5 years as an education and career development liaison for the Delaware Department of Services for Children, Youth, and their Families, and worked at West End Neighborhood House in Wilmington, Delaware, as an employment and education case manager for youth aging out of foster care. Thank you so much for being here today. Okay, so I want to take just a little bit of time to ground us all into today's topic. And I want to give a huge shout out to Lenore, who shared with me a report that I don't think is even publicly available yet. And one that, as I was preparing for today, just became, even in that moment, so much more valuable. And that I learned that recently the FBI changed over their database to collect crime statistics. And in that turnover, barely any state is prepared to utilize that new database. And so in turn, it's making our current crime statistics a little bit confusing, right? Because we don't have all of the data there. So what we have here at our fingertips, due to the generosity of Lenore and Alliance for Safety and Justice, is some information about the experience of crime survivors. So thank you so much for sharing this. So this is their second national study of crime victims. And in this study, they had 1,537 survivors of violent crime. or crime survivors rather, and 6 out of 10 were victims in the past 10 years, and almost half were victims of violent crime. So this report included a wide range of crimes. So of these survivors, they were more likely to be young, part of BIPOC communities, low income, LGBTQ, disabled, and have prior records. And they're 3 times as likely to be victims again of 4 or more crimes. Of these survivors, 74% did not receive mental health support, and 70% report at least one trauma symptom, and 96% did not receive any victim compensation. So in this report are also stories of survivors. And we also had the privilege this morning of hearing from a couple survivors as well. And in these stories, just learning the broad impact that crime has on the life of a survivor. So I want to take a second, and I'm so grateful to be able to share the story of Haley from Ohio. Throughout my childhood, starting at age 3, I was sexually abused and exploited by multiple family members. It caused so much pain that at age 6, I told daycare staff I wanted to stab myself and drew a picture of myself crying with a dark spot between my legs. Yet no one investigated or helped me. At 16, I disclosed fragments of the abuse after attempting suicide. I was diagnosed with PTSD and received some counseling, but I aged out and the progress was derailed. Children's Services substantiated my case, but no one was prosecuted. At 17, I left home. Trying to support myself, I found employment at a massage parlor. The owner sex trafficked me for 2 days. Ohio's laws at the time prevented prosecution. As an adult, I was sexually exploited for drugs. Then in 2017, I found the City Lookout Trauma Recovery Center, beginning an ongoing journey to heal. In the revolving door of the adult mental health system, I was asked what was wrong with me, instead of what happened to me. This led to misdiagnoses, unnecessary medications, and inadequate treatment, all centered on changing my behavior instead of helping me heal. What made my experience with the Trauma Recovery Center different was their focus on trauma-informed and trauma-responsive care. They helped me develop skills to cope with my triggers and process my past, and to find places for that pain to live outside of me. The wraparound, trauma-specific services offered by TRCs are vital to a survivor's ability to heal and thrive. Today, as a social worker, I see abused and neglected youth trapped in this same cycle, where their trauma-based behavior leads them to the juvenile justice system. When my abuse was reported, law enforcement expected a perfectly detailed, linear timeline of my experiences. But trauma affects your brain and memory. It's messy and complex. To help survivors, these systems have to change by addressing trauma at every stage of its process. And so what this story and the story of all survivors outline is just the pervasive impact that crime has on their life. And what you see here are just some other examples of the way that trauma can impact and derail someone from living the life that they want to live. And so all the more important as to why we have TRCs and are so grateful to have one here in San Francisco. And are also so grateful to have Dr. Boccellari here today, and for many, many years, building these kinds of programs, decreasing barriers to access for our survivors, and replicating the model throughout the country. So without further ado, I'd like to turn it over to you. Thank you.
Well, it is such an honor for me to be here today. The Trauma Recovery Center was born, bred, and nurtured here in San Francisco. And so many people have played a role in its creation and also in its success. And I just want to take 2 minutes to acknowledge those people. I want to particularly acknowledge Dr. Matt State and Lisa Fortuna and the rest of the UCSF leadership team. Also, Dr. Susan Ehrlich from San Francisco General. I, of course, need to recognize the wonderful team at San Francisco Trauma Recovery Center. These are clinicians and staff who on a daily basis bear witness to stories of pain and sorrow and tragedy. And yet they somehow manage to hold on to compassion and they keep hope alive. I also want to acknowledge our clients here in San Francisco, but in the TRCs across the country. These are clients who, on a personal level, have taught me so much about strength and endurance and resiliency. And those are absolute gifts that guide my life and, in fact, bring me here today. And last but not least, I'm surrounded by a number of amazing women. Dr. Metz, who is not only the moderator of today's events, but also is the director of the San Francisco TRC. I want to acknowledge Lenore and Tinisch. They are the most amazing partners I could ever ask for.
And these are two women who inspire me on a daily basis, and they make me believe that it's possible to move mountains. And last but not least is Ashley Biden. And Ashley is a powerhouse, and I've had the pleasure to work with her for the last year and a half. She keeps me on my toes. She is smart. She's funny. She is amazingly committed to this work. And on a broader basis, she's committed to changing the world. So without further ado, let me just tell you a little bit about how the Trauma Recovery Center got started. And I'm going way back. I've been a psychologist at San Francisco General and UCSF for a long time. And back in around 1997, the head of the surgical trauma team, Dr. Bill Schechter, said to me in passing, "We can sew them up, but we can't make them well." And of course, what he was referring to, San Francisco General being a level 1 trauma center, was the site and continues to be the site where all of the major physical injuries related to violent crime end up being treated. And at that time, back in 1997, and unfortunately, what continues to be the case around the country is mostly what hospitals do is to give a referral to the person to community mental health and keep your fingers crossed that somehow people who've been acutely injured at the hands of someone else will somehow find their way into treatment. And back then we actually did a study where we looked at 40 consecutive victims of violent crime on the trauma surgical units. And we did some baseline measures and found that 39 out of these 40 patients were exhibiting severe symptoms of acute stress disorder. And then 6 months later, this was not an intervention, this was a descriptive study. All 39 out of the 40 people were referred to community mental health. 6 months later, we followed up with them and found that not only did they continue to have symptoms, but their symptoms, in fact, had worsened, and not one person made their way into community mental health. And we know that there are many reasons for that happening. In any event, we were fortunate enough to be given some seed money to do a pilot study. And this is where I always give my mea culpa, because here was an opportunity for us to try to do an intervention with victims of violent crime to see if we could intervene with them. And I have to say, I failed miserably at that, because I had this idea that all we needed to do was to go to bedside when someone was recovering from being shot or stabbed. And I had this miracle solution for them. I said, we'll give you mental health treatment. And not one person wanted to take me up on that. And there were many reasons for that. Number one, PTSD pushes people into isolation. People don't want to talk about what happened. Secondly, there's a great stigma to this day around accepting mental health services. And, when we talk about trauma, we're talking about trauma, violence, and poverty go hand in hand. And there's a great deal of mistrust around receiving mental health treatment. And thirdly, I fail to ask survivors, what is it that you need? So, I use that because I really do believe that it's our failures that hopefully make us better at what we do. And so we ended up going on, we ended up meeting with survivors. We ended up recognizing that part of what they needed was they needed practical assistance. They needed help with safe housing. They needed help getting around. They needed help with filing restraining orders. They needed help with police reports. They needed basic safety kinds of things. And in the end, if we could make that available to them and we could build that trust and we could engage them and we did not judge them, that oftentimes they would end up accepting mental health treatment. Oops, I knew I was going to do that. Sarah, I might have you while I talk do this. So the Trauma Recovery Center model is based on the idea that let me look at my slide, the most harmed, oops. Sarah, it is contagious.
Set us off on a rock. We have such a great start.
Okay. So the Trauma Recovery Center model recognizes that the most harmed are the least helped. And we remove barriers to care and aim to transform services for survivors of violent crime. I'm going to go through this quickly. We know that only 20% of crime survivors are aware of victim restitution funds, and only 4% of survivors' needs are addressed. We also know that ethnic and racial minorities have the highest amount of unmet needs. I'm going to go through the model pretty quickly to make sure we leave enough time for the other panelists, but the Trauma Recovery Center model works by engaging people where they are. We have multiple entry points. It could be hospitals, it could be through the local victim service agencies, it could be through primary care clinics, it could be anywhere that a victim of violent crime shows up. And we provide a great deal of assertive outreach. If people can't come to us, we do home visits, we meet people in the community, and we provide, very importantly, case management services. And also, when people are comfortable, provide them with evidence-based mental health treatment. One of the things that we do, there's an emphasis on assertive outreach, clinical case management, evidence-based therapy, culturally responsive services, and very importantly, we try to integrate mental health, medical, social services, and we coordinate across the entire system of care. And so normally a victim would be left to negotiate these complex systems on their own. They would be left with talking to the police on their own, trying to find safe housing, trying to get entitlements. And if you consider the person who, I'm thinking about a young 35-year-old Latina woman with 2 toddlers at home, and her husband gets murdered, and she can barely get out of bed, and yet somehow she would be expected to negotiate all of these services on her own. So why trauma recovery centers? Trauma recovery centers work hand in hand with victim services. We serve people who don't necessarily go through the law enforcement world. So for example, most victims of violent crime, in order to get entitlements, have to file a police report. And if you don't file a police report, you're not eligible for victims' compensation. And we also serve people of color and people experiencing homelessness at higher rates. And we have increased access to victim compensation for survivors who are young and who have less education. I'm going to go through this pretty quickly. I want to get to the impact. We have been very data-driven from the very beginning. We have collected data, and we were fortunate enough early on to have done a randomized treatment trial. And some of the results that we have show that we were able to increase victims' attachment to supportive services. We were able to show that sexual assault survivors in San Francisco, prior to the TRC, only 6% got into mental health services, and afterwards it was 72%. We ended up showing that we were able to increase cooperation with law enforcement with a 69% increase in police reports, and we were able to decrease the rate of homelessness by about 41%. We also show a number of good clinical outcomes. 74% show an improvement in mental health, 51% an improvement in physical health, 52% show a decrease in alcohol use. PTSD symptoms were decreased by 46%, and depression by 47%. And we did a cost analysis and found the TRC cost 34% less than usual care. The results from San Francisco have been replicated in Long Beach at the Long Beach TRC. And as you could see, the results are pretty similar in that the Long Beach TRC also was able to show similar reductions in PTSD and depression. I want to talk just a moment about the replication of the TRC model. So we started out with one TRC in San Francisco, and then through the help of many, many different people, but particularly the Alliance of Safety and Justice, which you'll hear about in just a moment, we've been working on replicating the TRC nationwide. And at this point, there are 39 TRCs in 8 states. So we have TRCs in California and Illinois, Iowa, Ohio, Pennsylvania, New Jersey, Georgia, and Florida. And this Thursday, the New York City Council will be announcing that they're opening 4 TRCs in New York City. And we also have some pending in Orlando, Florida, 4 in Michigan, and 1 in Austin, Texas. And through this effort, we have now formed the National Alliance of Trauma Recovery Centers. And this is a wonderful group of people. So all of the 39 TRCs, we get together on a monthly basis. We share best practices. And I will tell you, all 39 TRCs are really committed to changing the landscape of victim services, particularly for communities of color, which have typically been not given access to services. So we have a website, and I'm going to show that to you, and then I'm going to turn it back to Sarah.
Here we go. Can you hear me okay? All right. Okay. Well, I would like to turn to Lenore. So Lenore, you are a national leader in the area of criminal justice reform and policy work in re-envisioning public safety. Can you talk with us a little bit about why does the TRC matter from a public policy perspective?
Absolutely. It's great to be here with everyone this afternoon. I anticipate that if you were listening the way I was, you could answer some of that question intuitively, which is the gap between the experience of being a victim of crime and the services available it's a chasm, right? There's a huge gap that exists for most people who are hurt by crime and violence. And this is a model that can fill that gap. So I think when we talk about, public policy, this is more than just important in the individual. This is important at the community level, and this is important at the state and federal level. This is a huge solution for public safety that should be really in every community. I'll tell you a little bit about how and why I came to fall in love with the Trauma Recovery Center model and champion it across the country. So I'm an attorney, criminal justice reformer, not a mental health clinician, not an expert in a lot of the issues that y'all are experts in. But after I left the district attorney's office in San Francisco, I was starting up Californians for Safety and Justice, and our task was to reform California's criminal justice and public safety systems and make them better. Right? Easy peasy. Okay. Just a few tweaks. Right? So this was a daunting task to think about how, across the country, but started in California and swept across the country. Most criminal justice systems for the last 40 years have been growing and growing a lot. And with that growth has come a lot of racial disparities, a lot of dysfunction, and a lot of depleting of public dollars. Okay. So many good folks, I've worked inside the justice system myself, a lot of good folks trying to do right in that system, but it is not known for its return on investment. And so when I was tasked with, what we should look at how to do criminal justice and public safety different in California, we started talking to legislators in the state capitol. And the classic thing that happens when you're talking about crime policy is there's this presumption that our current system is for victims, okay? And so if we want to change criminal justice and public safety, we have to be careful because that's actually the system that's for victims. Well, I've sat in, prosecutors' offices and community meetings long enough to know that struck me as odd. I have not experienced the criminal justice and public safety systems that have been built up to really actually meet the needs of most people who are hurt by crime and violence. So my colleagues and I, when we first began, we decided, well, maybe we should just challenge that basic notion that our public safety systems work for victims. Because if we could lift up the way in which it doesn't, we might actually be able to put forward models that do. So we started doing surveys across California asking victims of crime of all demographic backgrounds, do you trust the criminal justice system? Did you get services through the justice system? Did you access victim services? The responses blew us all away, right? Even those of us who thought, I don't know if victims are really getting helped here. Overwhelming distrust in the current public safety systems, overwhelming lack of access to basic crisis assistance, even more basic than whether or not you get support long-term for mental health, right? It's, did you get help filling out your compensation form? Did you get help finding another job now that you can't work because of a permanent injury? Did you get help finding new housing because you're unsafe in your own neighborhood? None of the survivors that we interviewed in those early years were able to confidently say that there was a system that was able to do that. So we decided that we were going to build campaigns and change state policy, and we're doing it across 8 states now, but our basic model is, here's some smart ways we can reform our public safety systems so that we can free up dollars and move those dollars to models at the neighborhood level that work. Our first meeting was December 2013. There was about 12 people in the room. We sat in a room in Oakland, California. It was all survivor leaders, right? Survivors who had gone on to become leaders for restorative justice, community violence interruption, mental health. We all sat in a room and we said, okay, go take your yellow sticky and put a sticky on the paper on the wall that says what you think is most needed for most people who are hurt by crime and violence and who are underserved by our current public safety system. So we sat there for about 5 minutes quiet, and when we look up on the wall, and the most recurring word and the most recurring phrase was trauma recovery, addressing trauma, trauma assistance, all of the things that this model addresses. So I was lucky because I had been in the prosecutor's office in San Francisco and had been inspired by the TRC as a local here. And so when we sat in that room, my colleagues and I looked at each other and I said, hey, there's this model in San Francisco, let's go check it out. So we went, we came, we got a tour. Everybody was like, why doesn't every neighborhood have this? So we started advocating, and that's when we got into state policy and other jurisdictions, and we're now at 39 trauma recovery centers across the country. And I'll just end by saying that the reason this matters so much, you know, for folks who understand criminal justice and public safety, there's this sort of conversation that happens around how are you going to stop crime? And most of that conversation revolves around how we're going to tweak sentencing laws, how we're going to deal with people who are coming in front of us as people facing conviction or having been convicted. But there's a whole other way you can flip the script. And you can ask, how can we reduce vulnerability for people who are being hurt? Okay, you get solutions like the Trauma Recovery Center that can actually solve cycles of unaddressed trauma, solve cycles of crime and violence more effectively, more humanely, right? By starting with the question of who's vulnerable to being hurt as opposed to who's at risk to committing a crime. Okay, it's really about flipping how you're seeing people, and if we can do that, this model would be everywhere.
Thank you. You can hold on to that. Okay. Thank you. And such an important perspective, you know, the fact that once you experience a crime, you're at such higher risk of experiencing another crime. And not only that, but an impact that can happen of having experienced crime is one way that trauma can show up is in turn perpetrating, right? So if we're able to jump in and heal from the beginning, you also reduce potentially that vulnerability of re-victimization and also that cycle of violence that can happen.
That's right.
Absolutely. Thank you. Tinisch, so you have done so much advocacy and community organizing work around the need for all communities to have safety. What do you see as the potential impact of the TRC model at the community level? Multi-part question, I will repeat. So what do you see as the potential impact of the TRC model at the community level? What does and doesn't already exist for survivors at a community level? And how can TRC fill that gap?
Let me start by saying I'm glad I don't have to stand up there to answer that, and I have the questions here, so I can reflect back to that. Really honored to be here and participate in this conversation. I'm a huge fan of the TRCs for lots of reasons. And I think we'll start here by framing it this way. Everyone, I'm sure, in this audience, and being mindful that in a room full of folks who work in mental health, I don't want to trigger anyone. But if you could recall a time in your life where you were personally destabilized, think to that moment what matters to you the most. That's what the TRC has the capacity to address for so many people who are in active crisis when their lives are destabilized by crime. It simply stops to ask the question, what do you need? It makes it easier for people to get that in that moment. One of the things that the TRC model has that's probably the most enticing for, especially as someone who's a survivor, is the open doors, right? That there are more than one. And that even if you as a survivor have not been personally guided to this door, there are multiple entry points in your community. There are multiple ways that you can access the services. And I think that people really underestimate or don't know how critical that is to safety, not just for the survivor or the victim or co-victims who might be affected by what happened, but for the entire community. It is critical that people not have to have the additional burden or stress of figuring out how they're going to survive what they're surviving. So the open doors, that the multiple access points are really, really important. The partnership the TRCs are developing with community partners is another really important thing. As a survivor of crime, when you experience this trauma and this tragedy, What we learned from the stats, but also from our lived experience, is that we're not hearing anything about resources and help in the moment that we're experiencing a crisis. We don't retain information, not even in that moment, but years down the line. And many times victims and survivors are being asked over and over and over again in that time when they're experiencing that trauma, questions about what happened to them, questions about their participation in the process to get quote unquote justice for what happened to them, dealing with their immediate needs, dealing with their families, dealing with their employment if they have it, or the lack of stability. All of those things are very real, and people don't have the capacity to retain that type of information when something is happening to them. So the TRCs meets the need because the services are available, but also because they have the partnership to keep being in front of folks to remind them that the resource is here, guide them into it, go to their homes. That's not something that's a common experience for many people who experience trauma and are victims of violence in our community. It's the exact opposite. Either they're not offered support or help, and that's maybe unique to other places. San Francisco is a little different, mainly because survivors like myself advocated to make sure that we're meeting the needs of people when crisis happens, especially around community violence and gun violence. But in many places, and when you talk to most survivors around the state, they will tell you they either weren't offered support, they were given information that was confusing or conflicting, and they didn't have the time or the mental or emotional bandwidth to go follow up on those resources. And they were being given a cold referral to an organization or to a partner or to a clinician that they had no relationship with. And the TRC addresses all of those things by being accessible, by building relationship with folks that people trust, by being in a neighborhood or in a city that they're familiar with, and by not leaving their side, by going to them. All of those things are really important. Now let me glance back at the rest of these questions that Sarah threw at me. The potential impact of the TRC at community level. I'm gonna go back to safety. And I think Ashley and I were just talking about that too. Like there's so many nuances, and especially because the victimization, especially in our communities for Black folks, for people of color, for people who are already marginalized and unstable, is so layered. The trauma that they experience, that we experience, is so layered. The incidents of victimization most often are not the first incident that people are experiencing. It may just be the most public. But people are carrying around this type of trauma and experience throughout their lives. Many of them have never had their victimization substantiated because they did not report it. And that is another huge, huge benefit of the TRC model, that people don't necessarily have to interact with law enforcement to still see their survivor experience acknowledged and get access to support. And then, as Dr. B mentioned, that creates an opportunity for folks who may want to participate in the criminal justice process to actually do that with some confidence because they have the support that they need. All of those things have a direct impact on safety, not just for the survivor, but for the entire community around them. Because the narrative and quite frankly, the truth is that when these incidents happen, folks are left to figure out how to stabilize their lives on their own. Many of us become refugees in our own city. We cannot return to the home because the home may have been the incident, may have been the scene of the incident. It's not safe for many reasons. And no one has the capacity or even the resources or ability to define what safety looks like for them. It's all within the context of what a program or what a system provides for them. So the TRC not only has an opportunity to fill a gap at community level by providing a safe space for people to get access and multiple ways for them to get access to services, it also validates what many people experience in their survivorhood, but also what they experience with systems, removes those barriers so that they can actually get the help, and then helps them explore those options with a through line to advocacy, so that people like Lenore and I and others around the country who are bringing this conversation into the policy arena can help remove those legislative barriers and other barriers, regulatory barriers, programmatic barriers, bureaucratic barriers that are all very real for survivors in that moment, whether they know it or not. So there's a lot of benefit of not only uplifting the model, but building that conversation between community, survivor, and advocacy so that people actually get access to the help that they need the way they need it, when a crisis happens. Go ahead, Sarah, pitch me the last.
All right. So in terms of what does and doesn't already exist for survivors at community level, if you have thoughts around that, and in terms of the gaps, how TRC can fill that gap.
Well, let me uplift what does exist, because I see some of our partners in here. TRC is a great one. We also have the Wraparound Project. I know there's SVIP in San Francisco. I'm a San Francisco native from Bayview, and over 20 years of doing this work, long before my family was personally impacted by gun violence, knowing so many people in the community that were impacted by lots of different types of crime experiences, we became heavy advocates to have a presence in our community when our communities were destabilized by any type of violent crime. And I'm glad that that work has continued, and that the city and even the systems and agencies that operate in the city have been very intentional about keeping that investment. So San Francisco in a lot of ways is a great model for that. Even with our district attorney's office, some folks are not eligible for state victims compensation. There are still other funds that they can access to get support. And many of our community organizations also fill in those supplements. That's necessary. No one agency, no one entity should be the sole access point for support or resources for survivors. And it needs to happen at multiple levels to prevent folks from cycling back into victimization. So in the hospital room, in the community, in their schools, in their neighborhoods, in their homes, it needs to be everywhere. Building models that are sustainable really require us to continue replicating them even more locally, right? So San Francisco has one, which is great. Every neighborhood should have one. Lenore says this all the time, but I'm going to take it a step further and say not only should they be more neighborhood based, but they should also be led by folks who have direct lived experience as victims and survivors. And that's another huge opportunity that we've had in our partnership together, is educating folks at community level on what this model is, how we build collaboration, how they build partnerships so they can actually replicate these models in their neighborhoods. So we have survivors who unfortunately have lost their children around the state. Some of them who have lost their children or have other victim experiences that are now looking at these RFPs that are coming out, partnering with clinicians in their community and designing their own TRCs in their neighborhoods to be responsive. And that is critical. We want to see more of that happening, and we want to be able to demonstrate what works well and good partnerships in cities like San Francisco and across the state.
Wonderful. Thank you so much. I think we're so fortunate here in San Francisco to have so many amazing partners, Zuckerberg San Francisco General Hospital, Wraparound Project, the DA's office. The list can go on and on, because we can't do it alone. And I think it's been such an amazing and unique relationship with Alliance for Safety and Justice, to where we can take our treatment data and we can use that to advocate, right? Like, I think one thing that changed was that domestic violence survivors and sexual assault survivors actually did not have to have a police report in order to gain access to entitlements, whereas historically they did have to. And so when you have these multidisciplinary, multi-agency partnerships that are all kind of aiming towards the same North Star, this might sound cheesy, but you truly can make magic, and you can really make movement and just provide wraparound services, and take it to the legislative level to build in protections and ensure that those protections are there.
Well, yeah, because survivors get to tell us directly their stories, but we also learn nuances and gaps through those stories, right? So that helps us in our advocacy. And even in some of the policies that are protected by crime victims, to your point, only certain victimization experiences were recognized in some of the policies. So, people who have been victims of gun violence, or their family members, or folks who may not be named in some of these policies, were still without protection. And so through working with survivors, bringing them in and providing, not just space, but partnerships where we have lots of different folks thinking of lots of different ways that we can remove these barriers, we've been able to effectively make that kind of change. And we'll do more. And that's one of the reasons why the TRCs are so important.
Thank you. And so, Ashley, you come to this with both a social work background and administrative experience running programs. You also have a unique access to the political landscape. As you work on a national level, what are some of the challenges and barriers for crime survivors that you have observed? And I'll let you answer that. Ask the next one.
Good afternoon, everyone. I am honored to be with all of you today and to be on this panel with my Shiros. And so just really grateful to be here. You know, I did have a unique lens growing up, right? I remember when I was little, I would campaign around with Dad. He was a very grassroots. I was a senator back then. He has been my whole life. And we would knock on doors and we would go to every single neighborhood. And, you know, and I was young, started very young, and I always questioned the inequity, right? Why did this area look like this? And why did this area look like this? And Dad always, you know, from when I was very young, encouraged me to ask questions, to explore, and to problem solve, and to make it better. And so really my career, I was direct service for a while. I was a case manager for 10 years, for many years, directly serving, being in the community. I thought I wanted to be a community organizer. And one of the things that I really kind of focused on was economic inequality, institutional racism, and structural violence, right? And so that's kind of where I started, and all of this is wrapped up together. One of the things too that I really want to be careful of as I do this work is in kind of pathologizing, right? So every single one of us knows somebody who has experienced substance abuse, mental health issues, right? It just socioeconomically, you know, there are, it's access and it's quality. And then you layer, you know, the history of the United States, and with that, with people of color, that adds a completely other layer. And so I guess my work, how I came to this is Delaware Center for Justice, I was running, we were doing pretrial reform, and ASJ, I got involved, I contacted them, and I was also looking, we were running a lot of programs for victims of crime. We had an elderly abuse. We worked with truancy. I started a truancy reduction program because, as we know, all the, you know, kids who are truant, usually there's something going on there. And so really started doing this work. We were primarily a case management agency. I really wanted to look into best practices, clinical practices, evidence-based, and I came across the TRCs. And so really kind of, you know, did my research, reached out. We actually were going to have a Crime Survivors for Safety and Justice chapter in Delaware. I happened to leave before we could get that started, but this is kind of where this work began. And why is this model is so common sense, right? It just makes sense. You know, it combines, it's a holistic model. It combines, you know, kind of a one-stop shop for mental health with evidence-based treatments. And I'll say that again, right? Evidence-based treatments. We could be in talk therapy forever and ever and ever. And if you go through trauma, right, as we say, disassociation, people don't remember, they block it out. And so one of the things, you know, that from EMDR to narrative exposure therapy, the model is based on incorporating evidence-based treatment modalities, which is significant. Because again, to PTSD, as you were saying, right? We'll go to your home, right? So many people can't leave their house when you have post-traumatic stress, right? And so, sorry, I feel like I'm not really answering the question I was given, but what are the barriers? I mean, there are so many barriers. There's, you know, without the TRCs, there's distrust of, you know, law enforcement. There is distrust of the entire kind of process. You know, and I know that California has done a really great job, but even in other countries, you know, prosecutors that we're working with, when I would go as a case manager and go up to them and people would say, well, why didn't she just leave? Well, so I think that there's so many barriers. And what I really believe is that everybody should have access to effective, quality mental health treatment. And people who cannot pay for that, right, cannot receive that, period. Even on Medicaid, the reimbursement is so low, so that no one's doing trauma treatments, and capacity issues, right? The community clinicians being trained on these evidence-based practices. So anyway, so when I trauma, this has been kind of healing communities, mental health. And so the trauma recovery just makes complete, absolute sense. It's practical, it's logical, it includes all the pieces, and it's from the point of view of the survivor, right? And what survivors need.
Thank you so much. And I think you answered this a little bit, but I guess there it is. You have an opportunity to space. This is going in and out. Okay. And so just, I know that hold on. Sorry, guys. Hello? All right. Take two. So, you have an opportunity to, and you've done so much work in so many different spaces, right? And so you mentioned that you researched the TRCs and you were really drawn to it. And the model for you makes sense. But yeah, I guess I'm just curious, even what pushed you to reach out, to want to be part of the National Alliance of TRCs?
Because I think it's the most effective model, truly. And, working with Dr. B isn't that bad either. When I contacted Dr. B about this and she said, well, come work with me. I said, absolutely, I am there. Because it truly is. This isn't, I'm not in the business, and I don't think any of us are being ineffective, right? There's too much to do, too little resources, all of that, too little time. And so this is truly the most effective model. And you don't have to have insurance. You can come as you are, right? As long as you are, a victim of a violent crime, we will serve you. And I think that is unique. I can't tell you, I currently run a trauma group with 20 women that are just recently out of prison. And it truly is amazing to me, the lack of any mental health treatment that they've gotten over the years, and the significance of trauma in their lives, right? And so one of the things too that I think we really need to do is, as you said, build capacity in community, train, right? Work with local schools to get people who are either were patients of our TRCs, who are just there to kind of help out and, go and knock on doors and make sure that people are whatever that assertive outreach, right? That we're also training them then to become the next clinicians, right? And so I truly, the NATRC, it works. And it's in 9 states now, 8 states, 39, more to come. And I really believe that every state and every community, if followed the TRC model, we would see decreases in violence. We would see many, many positive improvements throughout the country.
Thank you. And, I think that the neat thing about the model being replicated is our team, our technical assistance team at TRC and folks that are part of the NATRC get to hear the different ways that the model is applied, even, across California and now across the states. And to Tinisch's point, that each community has an opportunity to take the model and adapt it to what works for them. while holding the fidelity to the model. And, Tinisch, when we were preparing for today, you had mentioned something, and I hope you don't mind if I share something you mentioned, because it was very powerful to hear, and that the experience of crime, the presence of crime, as you mentioned, is just so layered. There's so many contributing factors, and there's so many contributing factors that keep folks from mental health treatment. But it's not just keeping them from mental health treatment, but what you said was that even in treatment, there's things that happen that push people out of treatment. And I think those are the pieces, right, that crime survivors and community members are expert at, and they know what they need. And so having this model that can be, adaptable into each of these communities, just in turn, not only makes it accessible, but hopefully keeps it accessible throughout the course of their healing process.
The beautiful thing about the TRC, it's pretty much spelled out for you, literally. I mean, Stacy and Dr. B put it together, a manual, right? And so that, I think that's the also having the National Alliance of TRCs to be able to provide agencies on the training to be able to follow the fidelity of the model. Because you're right? I mean, how many, one of the things I always found interesting was, and not interesting, but, if I pay to go to a therapist, right, because I have good in health insurance through Jefferson Hospital, and I don't like her, I'm out, right? It's not the case for people who are not paying, right? Oftentimes, this is the therapist you're assigned, right? So it allows for choice. And I think that, it's about the team. And this is a very holistic model, right? That is, it is laid out for you. You're having team meetings once a week to discuss, and it's basic. It's things that we all know, right? It's common sense, but it's formatted in a way that I think just makes sense and that is easy to apply. And that the NATRC, our hope is to get a national database. So we're just collecting all this data so we can, get more and more funding for these TRCs across the country.
Thank you so much to each of the panelists.